Hello everybody, my name is Sheila Aguilar and I'll be doing my video for the lab practicum for farm. That is my MON ID there. Um, and yeah, we're filming today from my kitchen table using stuff that I've used for practicing, so just keep in mind that, things are not as new as they were at the beginning of the semester. Okay, so the scenario is to inject medication via IV via 50 milliliter sodium chloride bag. Okay, that's an old tag there. Okay, so I'm going to check my medication order. I'm going to check for the patient ID, which is Alex Munson, MCP number 987-123-654000. I'm going to check for the place, which is LRC Munfan. I'm going to check for any allergies, which is Canon. I'm going to check on the date, which is December 3rd, 2020. I'm going to check at the time, which is 12 at noon, the medication, dimenhydrinate, a dose of 50 milligrams, route IV, frequency every 4 hours PRN. I'm going to check that it was assigned by the prescriber, Dr. Jones, a medical doctor, and is also signed by the nurse who transcribed it into the MAR, and the date there, December 3rd, 2020. Okay, so now I'm going to check that order with my MAR, and I got patient's name, Alex Munson, 987-123-654-654-00000. Allergies, no. The date is year 2020, December, starting on the day 3rd. I'm looking at my medication, dimenhydrinate, 50 milligrams IV, Q for hours, PRN, and I'm looking at the initials of the nurse that transcribed it and the second nurse that witnessed it or reviewed it, and both their signatures back there. So I'm going, after I administer my medication, I'm going to sign it in my MAR. Okay, so I will also check the reference book, and I'm going to check in here what the drugs used for, the contraindications, if there's any adverse effects, side effects, the IV use, and here it says that we can dilute it 50 milligrams in a 10 milliliter bag of NaCl, and give less 50 milligrams or less over 2 minutes. So I'm going to make sure that my solution it's okay with what says in the book, which is NaCl, sodium chloride, perfect. But I will be injecting mine in a 50 milliliter bag over 20 minutes instead of a 10 milliliter bag over 2 minutes. Okay, that's perfect. And I'm also going to use this to educate my patient about the medication. So I'm going to be aware of the 10 medication administration rights: right patient, right dose, right route, right time, right dose, right assessment, right education, right evaluation, right documentation, and the right to refuse. Okay, so since I got that, I'm going to do my medication checks. So my first medication check I'm going to do after I take it from the cover. Okay, so I took from the cover, I got dimenhydrinate, 50 milligrams per milliliter, and a 50 milligrams for IM and IV use. Expires November 2022, and I also got my saline bag, sodium chloride injection, 0.9% in a 50 milliliter that expires in March of the year 2021. Okay, so now I'm going to gather what I need to take my medication. Now these are supposed to be sealed, but like I said, I've used it before, but I'll treat it as sterile anyways. Okay, so I'm getting ready to take my medication, so I'm going to do my second check. So it's dimenhydrinate, 50 milligrams per milliliter, and I need 50 milligrams for IM IV use, and I need it for the IV, and it expires in 2022. And I'm gonna put it into my 50 milliliter bag of 0.9% sodium chloride injection that expires in March of 2021. Okay, so I'm going to clean up the surface of my vial. And while that dries, I'm going to get my syringe ready. And now I know that I need 50 milligrams, and I know that there is 50 milligrams in a milliliter, so I will draw 1 milliliter of the solution. Okay, so I'll be very careful. I'll draw 1 milliliter, a little bit over a milliliter, just to account for air and bubbles. Okay, and I'm going to inject it. I'm going to inject it, and I'm going to take out a bit over a milliliter. Okay, it's perfect. Okay, and now make sure there's no bubbles. Okay, perfect. Now, I'm going to inject that into my NaCl bag. So, I'm going to put the bag close to the end of the table, and I'm going to be very careful with the needle. I'm going to take my little wipe, and I'm going to wipe the end of it. Of course, it will be a new clean wipe, but I'm out of supplies at this point. So, okay, so I'm going to inject, I'm going to wait for that to dry, and I'm going to inject it into the bag. Perfect. And now that goes into my sharps container. Oh, I forgot to show you my setup. So I have my papers and my stuff there. By papers I mean my stuff. My Mr. Monson here, and my bag up there. Okay. Perfect. Back at it. Okay, so I got my, and I'm going to mix it. Perfect. And I'm just gonna make sure that I got the right medication. I'm gonna do my third medication check. Okay, so it was dimenhydrinate, 50 milligrams that were in 1 milliliter, 50 milligrams for IM IV use to IV that expires in November 2022, and I put that into my 50 milliliter bag of 0.9% sodium chloride injection that expires in March of 2021. Okay, so now I'm going to do my label. So for medication, I got dimenhydrinate, 50 milligrams per milliliter for Alex Monson, room number 2, given by S. Aguilar, Monfon 2. Okay, and I'm gonna put that there on the date, December 3rd, 2020. Okay, so that's my medication. It will be useful to calculate the rate since I'm here. I added 51, so I add 1 milliliter to the 50 milliliter bag, so I got 51 milliliters that I'm going to be given over 20 minutes, and the rate, the drip rate is 10 drops, so times 10 GTTs per milliliter. So that's my formula there, and that's gonna give me 25. So, math is difficult. 25.5 GTTs per minute. So that's approximately 26 GTTs per minute. And I'm going to, just so I know better, I'm going to count that over 15 seconds. So I'm going to divide it by 4. So it's going to give me 24, let's see, 6.5 GTTs per 15 seconds. So approximately 7 GTTs in 15 seconds. That's gonna be my drip rate. 7 GTTs per 7 drops for 15 seconds. Okay, so I'm gonna go take my things that I need, my MAR and my medication, my supplies, into the patient's room. I'm going to knock on the door, do hand hygiene, introduce myself to the patient. Okay, Mr. Monson, my name is Sheila Aguilar. I'll be your nurse today. Please state your name, your date of birth. Alex Monson. Okay, perfect. And I'm going to check in the MAR. Alex Monson, 987-123-123, 654-654-0000000. Okay, perfect. So Alex Monson, Mr. Monson, I'm gonna give you. You requested some of something for your nausea, so I'm gonna give you some of this gravel. Just so you know, some of the side effects are headache and drowsiness. So. Yeah, so are you okay with the medication? Yes, perfect. Okay, so I'm going to check the site to make sure there's no phlebitis, make sure that the drip is actually, the pump is dripping. I'm going to make sure that the is actually in. Perfect. So before I do anything, I'm going to open my supplies. Oh, this was supposed to be in my bag. So I'm gonna open my supplies and I'm gonna make sure I put this on before so because we're working with gravity, my primary line has gotta be lower than my secondary line. So I'm just gonna put that there as such. And I'm going to make sure that this is clamped and closed. Perfect. And now this is a sterile technique. So before I do anything else, I'm gonna put my gloves on. Okay, so this is a sterile technique, so I have to make sure I keep sterility. So I'm going to remove my, so this is, yeah, it's clamped. I'm going to remove my plastic thingy and this. Now, I have used this many times, so ideally I would have it hanging, but I'm holding it in my hand because if not, it's gonna drip everywhere. And I'm going to do this. Okay, and now I'm going to prime it. So I'll put the cap on, doesn't matter. I'm just gonna do this really quick. Let some of that water in, and I'm gonna open this just to prime it. Perfect. Okay, and I'm gonna place my IV bag there. Okay, so I'm gonna close the this line here, and I'm going to notice how much went in. So 100 So 150 milliliters of the primary line went in, and I'm going to record that into my in and out sheet. So I'm going to clean the port closest to the IV bag. It's clean, and I'm going to take my, again keeping sterile technique, I'm going to take my piggy bag right there. That's perfect. Now I'm going to set the rate of 7 drops per minute per 15 seconds using the clamp at the primary line. Okay, so I'm going to do that. So I'm looking at this one here. I'm going to open it. Sorry, I'm looking at the secondary line, so this one here. So I'm going to open it a little bit. So I got my medication up and my primary line down. Okay, I'm going to open it, and I'm going to count the drops that fall. Oh, sorry. I'm supposed to open this one, the secondary line, the clasp of it. I'm supposed to open it. Okay, now I can count how many drops go in 15 seconds, and let's say that there's 7 drops per 15 seconds. So I got my 25 drops per 26 drops per minute. Okay, so take off my PPE, do hand hygiene, and I'm going to thank you, Mr. Monson. I'll be back in 20 minutes to check on your bag. So I'm going to come back to my office, and I'm going to record what I have given. So it's 9 o'clock in the evening, so I'm going to record in my mind that at 9 o'clock is 21 hours. At 21 hours, I gave this medication. SA is Aguilar, Monfun 2. Perfect. So that's my signature there. My initials and my signature, and I'm going to record in my input and output. So as you can tell, as you can see, the primary line, that's the primary line. So I said that at 9 o'clock there was 150 milliliters. So, and I just put in at 9 o'clock, I put in the IV med of dimenhydrinate at a rate of 25 milliliters per minute. And my name is S. Aguilar, Monfun 2. Perfect, so that's the medication there. So in 20 minutes, I'm going to check my patient, and I'm going to make sure that the medication has run through, and I will write down there how much went in, which should be 50 milliliters or 51 milliliters, and I would also go back and make sure that the primary line, to adjust the rate to the initial rate, which is 50 whatever was set up to, just to make sure that it's not going too fast or too slow for my patient. And yeah, so I did my documentation and I educated my patient. So I believe I am finished.